Welcome back. We care a great deal about the unborn and the newborn, right? Well, what are we doing about the thousands of babies born every year in Florida already addicted to opioids? In 2015, over 2,400 babies were born in Florida addicted to opioids because of their mother's use, 5 times more than in 2005. There are consequences to them and to us. And joining us for more is Dr. Washington Hill, an expert in maternal fetal medicine at Florida's Department of Health, and Dr. Parimi, director of the Maternal Fetal Neonatal Institute at Johns Hopkins All Children's Hospital. Gentlemen, thank you both for joining us. And Doctor, I know you don't like us using the term that these babies are born addicted. Why?
I think what is important is to remember that they are babies of women who may have an addiction, just like a mother who has diabetes. But then the baby has the results of that addiction, but I don't like saying that they are addicted themselves.
The problem, I would imagine, is because the official way to describe this issue is neonatal abstinence syndrome, or NAS. And for the public, I mean, that's an acronym that most people are not familiar with.
They are now familiar with it, and I think you're right. If we were to change it, and some have suggested that we change it, they would not know what we're talking about. So we'll just have to stick with NAS.
So, if I may add, sure. I think what it basically means is the babies during growth are being exposed to the opiates that moms have been consuming for a long period of time. So what the neonatal abstinence syndrome in fact refers to the symptoms the babies manifest as a consequence of prolonged exposure to these opioids during development.
And I have 2 questions there. Yeah. What are those symptoms, and are they permanent?
Right. So let me first sort of address what the symptoms are. The symptoms pertain to what we call a central nervous system. Babies have high-pitched cry, incessant crying, and they have some of the babies have seizures, and they have prolonged periods of wakefulness. They don't sleep well at all. That's part of the pertaining to the central nervous system. Other symptomatology relates to what happens into the bowel GI tract. They have diarrhea, and they have rash around the anal area, which is extremely painful, and some babies sweat profusely. They have high temperature. So what we know is that all these symptoms occur as a consequence of changes in their chemical imbalance.
Dr. Hill, this is such a crisis on both a local, state, and federal level that you have, it's beyond a partisan issue at this stage. A lot of the people from the state to the federal government are talking about getting resources available to deal with these kinds of situations. At the Florida Department of Health, do you have the resources you need to help the mothers and the children who are dealing with this?
I think that whether it's the Department of Health or the hospital or other agencies, particularly those that do a lot of counseling, we can always use more resources. And the governor said that we have an epidemic and set some resources aside for that. But do we have enough? I think the answer would be no.
And I know that it's the same question to you. And sure. I want to talk, you're embarking on a fascinating research project, and I want to talk about that in a moment. Sure. But first, in terms of the resources that you're seeing.
Right. I think what is important is that if you even read the recent publication on triple aims, the whole care is fragmented. So we have these mothers being cared for in an OB office, and then the mothers appear with or without adequate prenatal care into a delivery room where the babies are born. And then the babies are discharged to the pediatrician, and then a lot is unknown about their short and long-term outcomes. Cool. So what we need is defragmented, and we need to have a cohesive approach along the whole mother, infant, and childhood continuum.
Okay, we are just getting warmed up. We'll have much more on opioid babies right after we check the first alert weather, so stay with us. We are talking about opioid babies, and joining us for more is Dr. Hill, an expert in maternal fetal medicine at the Florida Department of Health, and Dr. Parimi, director of the Maternal Fetal and Neonatal Studies at the Institute of Johns Hopkins All Children's Hospital. One question I wanted to ask both of you in the last segment is we've talked about the link in terms of the effect on babies if the mothers are taking opioids. Does the father's use have any impact on the child?
Not that we know of. The only effect would be a sociological effect of involving the mother or the pregnant woman in using drugs. And that does happen.
Right. And doctor, the million-dollar question a lot of people out there might be wondering now is, are these effects that of opioids on babies reversible over the long term? Do we know exactly what will happen to the child in terms of health in the years to come?
I'll break it down to sort of a couple pieces there. I think the first thing that we need to know is that when the mother is using opioids, these opioids bind to what we call receptors in the brain, and there is early evidence to show there are already brain MRI changes around the time of birth. And that evidence is very clear. And then what happens in the intensive care unit or whichever unit the baby is cared for, baby begins to develop these withdrawal symptoms because the umbilical cord is cut and the supply of opioids is suddenly disrupted. What we do not know yet is what are the long-term consequences of this opioid exposure in utero.
Who's doing the research?
Right. So there is few data that are currently available dating back to around 15 to 20 years ago to show that babies who are exposed to opioids, mostly it's a European study, that these babies may be showing hyperactivity, some attention deficit hyperactive disorders. But there's no robust evidence to basically link this opioid exposure to short-term and long-term outcomes, meaning at 2 years of age and 5 years of age. So that research still to be done, and we at Johns Hopkins All Children's Hospital are currently embarking on that initiative, and we call that ACT Now. That means we need to align the care transformation along the whole continuum from the mother to baby and begin to understand when these issues manifest in the neonatal period and what happens when the babies are 2 years old, 3 and 5 years of age.
Who's paying for this research?
So we are very fortunate to get in this initiative through philanthropy, and we are extremely grateful to that person to allow us to examine so that we can make a difference in the life of this mother and the baby.
So we're not talking about federal or state funds, we're talking about private philanthropy, charity.
Absolutely.
You want to tell us who?
No.
No, I'm putting you on the spot. Dr. Hill, are some of the questions here, are those the questions that you want to see answered, that you need to know if you're going to more effectively, serve the community, the women and the children?
Absolutely. Because now when a woman asks me, good question, how's my baby going to be at age 5? I think for the most part we have to tell her we're not sure. Research is ongoing, but we're not really sure what the effect may be. But what we are sure of is that we need them involved in follow-up care.
This is a tough question because what we're seeing in the news is that opioid abuse is affecting all ends of the community, that, from people who come from
everybody,
high-income families to low-income families. But I bet right now a lot of people are watching this and they hear you talking about the mother asking what's going to happen to their child, and they're saying, well, how does this woman get pregnant while addicted to opioids? Shouldn't they have known better?
Complex question. How did they get pregnant? I think we all know how they got pregnant. They are in a situation where they're not bad people. They have a bad problem, and that bad problem is addiction. We have to find ways, while they're being treated, while they're being counseled, to help them not get pregnant. And a part of our program has been making sure that the clinics that give them their medication also can give them information about birth control.
What clinics are you talking about?
The methadone clinics, the medication-assisted treatment clinics, whether it's PAR or whether it's Metro. We know that these women are receiving medication. We know that they are addicted. A part of their multidisciplinary care and counseling has to be family planning.
And how is you said earlier that you could always have more resources and more funding, but in terms of that kind of education, how are your funding levels?
The same as I said. We need, for example, we need more residential programs. A woman is pregnant, she needs to get away from the environment that she's in. She needs to go to a residential program where she can either be withdrawn from her medication or it continued under a controlled situation. In Sarasota, we only have 17 beds for that.
17 beds
17
in all of
beds
Sarasota County?
for pregnant women who have an addiction, who may need to go into a residential program. That's where we could use additional funding for residential programs and counseling.
Where do you see that coming from, the state or the federal government? Because frankly, both our state legislators and the governor, and on the federal side, our congressmen and our president, they talk a good game.
Right.
But are they coming through in terms of what is really needed to deal with this?
They could do more. They could do more, and they could do better. You're absolutely right. The current situation does not look good for having more beds in terms of this residential therapy. In fact, several years ago, there was discussion about cutting back.
If I may just add, I think a couple of things that we need to look at. I think we need to think about a little bit different in terms of how we care for these mothers, fortunately or unfortunately, on this medication, because some of them generally being on opioids from pain control, and some take it illegally. I think what we really need is to have a non-judgmental approach, an equitable approach, and if I were to do it, I think what we really need is to embed three key people: an OB doctor who manages the baby, a pain specialist who could potentially decrease the dose or whatever it is to see if that would have any effect, and a psychologist to help the mental health initiative component of it, which I think is very key in order to at least begin to understand addressing that issue during the prenatal period to have any impact on the fetus and the mother.
The problem with that is that you're saying a non-judgmental approach when we're living in a more judgmental society than ever before, and linked to that is putting the money where the need is.
The reason I say it's non-judgmental is because once we begin to identify them being an addicts and all those things, the likelihood of that mother coming for prenatal care is very low. Consequently, not only are we jeopardizing the health of the mother, but potentially the fetus. In fact, the data shows those who do not get adequate prenatal care are born premature, have low birth weight, and also get into some issues that Dr. Washington Hill can potentially address.
But I think in this community, we have the resources for them to get prenatal care. We still see patients who deliver at the hospital who have had no prenatal care. But if a patient is pregnant and addicted, there are many resources for her in our community, including the program that we're involved in.
Okay, we are just going to take a quick break, and we'll be back with final thoughts in a moment. Our guests join us right now for final thoughts, and Dr. Hill, there's something that you want to tell our viewers about the program that is at our disposal here in Sarasota County.
Thank you for allowing me to do that. We have a program called Addiction Support in Pregnancy, or ASAP. And what this program does, it has brought together anyone who touches the addicted pregnant patient, from drug court to DCF to the hospital to the health department. And I want your listeners to know that that program is available for them, or if they know someone who is pregnant and using drugs. The best way to contact us for that program is through any of the partners. And the partners include First Step, the Department of Health, the hospital, so that we're out there and available to help them and to help them with counseling and support.
Dr. Pirimi, can you venture to guess, in the cycle of this crisis that we find ourselves in right now, where are we? Are we at the worst point? Do you see any evidence that that we're getting a handle on this, a grasp on this, finding a way to better deal with this?
I think the current approach has always been how to reduce length of stay in the hospitals. I don't think that should be the approach. every year, according to the recent publication, 22,000 babies are born with exposure to neonatal abstinence syndrome. The other data shows every 25 minutes, one baby is born exposed to NAS. So what I think is that we now have a generation of babies who are exposed to these opioids. We are yet to see the consequences.
And in terms of consequences, these babies with these kind of symptoms are going to grow into adults, and the obvious question is, how is that going to affect their ability to get an education, and are they going to wind up in the criminal justice system? Venture to guess, Doctor?
We don't know. But there was some thought before, remember, during the cocaine days, that maybe they did end up in the criminal justice system. But I think right now the best answer that I can give patients is to say, we don't know. We need you to make sure that that baby has appropriate follow-up.
What do you need right now in terms of resources that you do not have, aside from beds?
Beds, counseling, behavioral therapists, neonatologists. Those are the things that we need.
Okay, thank you, gentlemen. FYI, you can watch past discussions on demand. They're available on Apple TV, Amazon Fire, and Roku. And for the latest local breaking news, don't forget to download the updated version of our app. If your current app does not work, that's because it is expired. Just go to the App Store and re-download it by searching for WWSB or My Suncoast. We want to thank both our guests for being here tonight. Dr. Washington Hill is an expert on maternal fetal medicine at the Florida Department of Health, and Dr. Parimi is director of the Maternal, Fetal, and Neonatal Institute at Johns Hopkins All Children's Hospital.